So I'm going to start just by welcoming everyone on behalf of CDKN and South North and the Africa Hub of the Resilience Hub of COP27. It's a great pleasure. I think if you've if this is your first session of the day, a big welcome to you. If you've joined us throughout the day, thank you for participating and getting to this point. And it's fantastic. We've had some really, really interesting discussions and showcasing of some incredible resilience solutions on the continent. I, for one, have been very inspired. And we're now going to turn to a very important topic, extreme heat in African cities. And it is definitely an underexplored area and very much an important agenda. And I know that the Africa chapter of the latest IPCC report mentions extreme heat in African cities quite a bit. And so this is a very important topic to be taking forward in the Resilience Hub and into COP27. So without further ado, I'm going to hand over to Vincent, who's going to be chairing the session, and all the best for a very fruitful session.
So much, Lisa, and for the introduction, and also welcoming everyone in the group. So let me say thank you for joining this wonderful session, and we will right away start. And we are the Chance Network, and I want to briefly take you through or explain to you what the Chance Network is for your own information and of joining us. So I want to share my slide. All right. I hope you can all see my slides.
Yes, perfect, Vincent.
If that's so, I can continue. Can you all see my slides?
Yes, Vincent, we can see your slides very well.
Okay, thank you. I just wanted that feedback. Thank you very much. Means climate help, African management, which is a network that tries to bring together policymakers, researchers, stakeholders working on climate change, also develop new ideas together. The network actually falls within the International Climate and Health Network of Research Projects, which is called NBEL. NBEL means Enhancing Belmont Research Action to Support EU Policymaking on Climate Change and Health, which is funded by the EU. We have about 4 objectives, which is to develop synergies in East and Southern Africa, knowledge exchanges, learning and cooperation, to advance policymaking across the region, and to provide for national or regional application of funding for climate and research. We also have thematic areas that we are focused on: air pollution, which includes heat from wildfires, as well as climate financing. We have got key activities that we usually do, such as holding bi-monthly workshops, as well as international conferences, which are yearly. I'll explain that later. Anyone is free to join our network, especially if you're working on local or national government, research institutions, climate services, humanitarian organizations, NGOs, and all other organizations or individuals that are interested in climate health. And today we are here in this platform presenting issues around heat in African cities and why heat does matter at this point in time. And as the world braces for more intense heat waves, fueled by climate change, urban centers across the world are unprepared for disasters which are brought by heat. And cities can run several degrees hotter than non-urban environments. That has been found out that cities get more hotter for various reasons. Sometimes because of the such as the alphabet, pavement, the roof shingles that absorbs heat more the soil that we find in rural areas. And also cities, that are closely packed buildings and streets which are packed. And most of the time, people in cities, they actually suffer the most. On top of that, our healthcare systems as well are not that well prepared to actually take care of extreme health impacts, heat impacts that comes with this extreme heat in cities. And today we are going to discuss these issues around heat in the. Our speakers who are going to discuss, and after our discussions, we're going to have a kind of a group session where we'll divide our participants into groups, and we come up with messages that are derived from all these discussions. So before we go to our speakers, I want us to invite Bettina to come and actually give us what bothers us at the moment. Bettina, you.
Thank you so much, Vincent. Yes, and I'd like to invite all of you to tell us what bothers you in a particular way. I think you should have a clickable link if you're on the app. And maybe you can just type into your browser, if you're joining from a browser, in a new window, tinyurl.com/African city. It's tinyurl.com/African city, because we would like to know from you, and maybe Vincent, I can ask you to stop sharing this slide for a moment.
Yep, no problem.
We would like to ask you to share with us what really bothers you when you think about African climate, so extreme heat in African cities. What bothers you? And if you have logged in, you should see this particular window here that says, sometimes you need to shout it, sometimes you need to rant it, you don't need to worry, everything will be in all caps, everything is anonymous. And the point is not to overthink, but just to let it flow and say, for 90 seconds, when you think about extreme heat in African cities, what bothers you? What do you think is a problem? And it'll be entirely anonymous. So if you tell me you're ready, maybe you can say ready in the chat. That'll be amazing. If some of you are ready, then I think we can go. You ready? Don't hear anyone being ready yet. Are you still signing in?
Yeah.
Okay, let's give it a moment. And you can already think about what bothers you when you, okay, still signing in. What bothers you when you think about cities and extreme heat? Emma, you're the first to be ready. Well done. We'll wait for a couple of others to be ready so we can run together and say, can we just really say what bothers us? Roop is ready. All right. Leonie is ready. Okay, I think we'll maybe hopefully have a critical mass. If you want to, you can still sign in. It's not too late. But I think we'll start renting and go for it. You have 90 seconds. Please rent. Type a word or a couple of words, hit enter, and type the next word. Inequality in heat, pollution, keep them coming. Type faster. Informal settlements. The poorer ones are suffering the most. Great. The media doesn't report heat, poor public transport, poor air quality. Really nice, keep them coming. Lots of challenges we're facing in urban spaces in Africa. When it comes to heat, no escape, no green spaces. Children, how they're affected, no trees. Great, you have 37 seconds left to just hit enter. Neoliberal capitalism, small rooms with little ventilation, warnings, no infrastructure, ugly concrete everywhere, poor maintenance, no ventilation, corruption. They're coming fast and furious now, very good. And 16 seconds to spare. Indigenous cooling, really, I like that. Mortality. And on this somewhat sober note, the rent is up. And I would like to say thank you so much. We will revisit this rent if there is time at the end of the session to see if you have any suggestions of what we could do after we've listened to the keynote speakers and the panel for a little bit, and then explore things in groups. We'll hopefully revisit this to say, so what do you think we should be doing about these things that bother us so much? And I hope you can take some inspiration from this rent. I hope it surfaced some of the issues. And with this, and I think without further ado, I hand over back to our MC, Vincent. Thank you, Vincent.
Thank you so much, Pete. The exercise really gets good reflections from that. But we need to continue with our speech. We have 3 speakers for today. We have got Roop, Gloria. I will now invite them to speak for 8 minutes before we end the session. I'll start with Roop. If you are ready, please share your slides. And please introduce yourself fully to the audience.
Yeah, absolutely. Thank you so much, Vincent, for the wonderful introduction. I'm going to share my slides. 1 second. Okay. Excellent. So my name is Roop Singh. I'm a climate risk advisor with the Red Cross Red Crescent Climate Center, and also part of the NBEL project. And I want to start today to share a little bit about what we know about heat in cities and heat in cities in Africa in particular. And I want to share some of the places where there are gaps in our knowledge, but also what are some of the practical things that are already starting to happen, and what are some of the areas of growth potentially where we could see more action in the future. So to kick us off, I want to share a little bit about what we know about heat in Africa in general. And a lot of this information is shared in the most recent IPCC AR6 report. So, of course, we know that Africa is warming. The graph on your left is basically showing in the past 35 years the climate trends, and we're seeing that overall temperatures in Africa are rising at 2 times the global rate, so faster than in many other parts of the world. Not only that, but in recent years, in 2019 and 2021, those 2 years were tied as Africa's 3rd warmest on record. And so we're also starting to see more heat, extreme heat in recent years. And so if we look to the future, a lot of the projections that we have on extreme heat in Africa are quite dire. So one of the ones that stood out to me in particular is that over 300 million urban Africans will be exposed to 15-day heat waves over 42 degrees Celsius by the end of the century. And that's quite significant because that's a huge population. Another statistic that stood out to me in particular is that children born in Africa in 2020 are more likely to be exposed to 4 to 8 times more heat compared to people born in 1960. And so we're starting to see this shift in generational change as well in terms of the amount of heat people are exposed to. And perhaps one of the most important sort of takeaways from the IPCC AR6 report is one of the reasons why heat is such a pertinent issue in Africa is that much of Africa is subtropical or tropical. And so it's already hot. Humidity already tends to be high in certain areas. And so it doesn't take a lot to go from already hot temperatures to reaching sort of dangerous thresholds. And so those are some of the reasons why heat is such a pertinent issue. So what do we know and what don't we know? So this is a map that was created as part of a paper a couple of years ago. And so you'll notice there's a lot of blue and red dots. The places where there are red dots are places where we've established a relationship between heat and deaths. So it's been documented that heat leads to some level of mortality. The places in blue are where we have studied specific extreme heat episodes. What you'll notice is that there's an extremely low number of studies across Africa, across South America, parts of Asia as well. But just to say that this has changed since this map was first created. So there has been an increase that we've noticed, especially in the past couple of years of research, but also to mention that there are lots of research gaps, and we really need to be better at understanding what are the impacts that extreme heat creates in different parts of Africa. So now that I've sort of given the background of what do we know, what's going to happen in the future, and what are some of the gaps, I also want to share a couple of examples of what people are doing around the world to combat extreme heat. The first example I want to share is from Australia, in which the Australian Red Cross has set up this telephone hotline where they already have registered a number of sort of elderly and more vulnerable people whom they check in on a regular basis. But when there's a particular extreme heat event, they will give phone calls to all of the beneficiaries who are on this list of people who are more vulnerable to extreme heat to check in if they have a cool place to go, if they're feeling any signs of heat exhaustion or heat stroke, they can send in an emergency medical team. And so it's been a really great example of a way in which the humanitarian organization has started to take action on this on the local level. Another example is from Cape Town in South Africa, where they've set up these sprinkler parks. Oftentimes we actually see a rise in deaths from people drowning during heat waves because it's so hot and people tend to go into swimming pools or the ocean, and perhaps they don't necessarily know how to swim or are just impacted in that they're affected by we tend to see an increase in drowning deaths, essentially. And so these sprinkler parks have been created as a way for people to cool off, but also to avoid some of those other dangers that can come with people trying to cool off. The third example is from Vietnam, where in the city of Hanoi, the German Red Cross and the Vietnam Red Cross got together and they created these cooling shelters and cooling buses specifically for roadside vendors, because they identified that roadside vendors, because of their jobs, have to be outside all day in the extreme heat. They're more exposed. Construction workers and roadside vendors were their particular target group. And so they had these cooling buses driving around the city where they knew these people tended to be. And so they would give them a lift to the cooling center. They would have emergency medical care there. They would have fans and a nurse there to assess if they had any symptoms of extreme heat. That's another example. And then the last example is from Lusaka in Zambia, which actually Bettina participated and sort of led, but it was a tactical urbanism in which they demonstrated ways to cool down during an extreme heat wave. So this is just an example of someone explaining what to do. They had water in which people can put their feet in, and they had drama and other awareness raising exercises. So those are some examples of what have been done already. And of course, we've also written a heatwave guide for cities in order to help cities around the world figure out what can they do if you have no sort of meteorological information or warning of extreme heat. There are still actions that you can take on a seasonal level, just knowing that your heat season is during a particular couple of months. But if you do have forecasts, there might be other actions you can take. And so this heatwave guide was written together with lots of different organizations and supported by a lot of different organizations, including in Africa. And there's tons of examples of what's been done, but also step-by-step instructions on how to create a heat action plan. And I'm sure we're going to have more time to talk about this in the discussion, so I won't go into depth, and I will pass it back over to you, Vincent.
Thank you, Roop. Thank you, Roop, for the wonderful presentation. And I'll now call on to our next speaker, Gloria. So I'll share the slides for you.
Thank you.
And please introduce yourself.
If you can go to the slide, thank you very much. Can you hear me? Can you hear me?
Yeah, we can hear
Yes.
you.
Okay. If we can just go back to PowerPoint from the beginning, please, Chair. Thank you. So my name is Gloria Maimela, and I'm from Betarachai. And, you know, my angle looks at healthcare systems and healthcare professionals. Yes, African cities are getting hotter and hotter, but so are health facilities, so are our healthcare providers. They're also getting hotter and hotter, and they're also getting an impact. They've been impacted negatively by excessive heat. So therefore, any intervention that we come up with has to take that into cognizance. Lest we learn from the lessons from COVID-19, that immediately as soon as the COVID-19 pandemic hit us, we in Africa especially, our health systems were already fragile, and we saw our health systems in most instances collapsing because of the burden of disease. Next slide, please. Next slide. Yeah. Next slide. So literature, you know, and then most of the literature that has come up, obviously, you know, as Roop said, that most of the literature is coming from, you know, developed countries and less from the developing countries. But we have made a link. We have made a link between climate change and health. We have seen poor outcomes in pregnant women. We have seen poor outcomes in the most vulnerable, the elderly. But we're also seeing impact on healthcare workers and healthcare systems in particular that require urgent intervention, particularly in Africa. Next slide, please. So what are the direct and indirect impact? So first of all, if you look at healthcare professionals, you know, themselves, they're exposed to what we call heat stress due to exposure to excessive heat in working environment. And, you know, think about the midwife who's sitting in labor ward where it's extremely hot, or even in neonatal units where I've been in neonatal units myself, where the temperature are getting hotter and hotter, and that is already impacting on the health of our healthcare workers. You know, we know that, you know, most of our healthcare workers, yeah, you know, they, especially in Africa, you know, they're much older, and they're getting, you know, worsening of existing, you know, chronic diseases. We've made a link between worsening, you know, excessive heat and worsening of non-communicable diseases such as diabetes, chronic kidney failure, and so forth. And as healthcare workers become dehydrated, the renal function deteriorates. And that's, you know, for example, you know, healthcare workers with diabetes, we know that, you know, as they're exposed to heat and dehydration, the renal function tends to worsen, and that has a direct impact on their health. We have seen onset of new health-related chronic diseases as a result of excessive heat, and this is linked actually more toward to air pollution. We're seeing a lot of healthcare workers coming up with, you know, asthma and other respiratory diseases that are rendering them incapable. There's a decline, so there's an ILO international labor report that has actually shown that when there's excessive heat, there is a decline in productivity. Yeah, there's also a decline in productivity results in absenteeism, presenteeism, where people just come to work for the sake of it. They are tired, they are hot, and they cannot be bothered. We've also seen that there is a risk of poor staff attitude. For many years, we've been trying to, pin down why sometimes you get the issues of poor, staff attitude. Although they are multifactorial, we know that heat also is a contributing factor, because you can imagine you're in this labor ward, you're hot and bothered, and people are coming to you. And if you can go back to the previous slide, please, Chair. You're hot and bothered, and you're not able to cope with the excessive heat. We have seen an emergence of mental illness in healthcare professionals because of excessive heat. So, we're seeing a rise in depression, we're seeing a rise in post-traumatic stress disorder, we're seeing a rise in emotional distress directly due to excessive heat. On the other side, indirectly, as we have excessive heat in the African region, we're seeing more and more climate and health related disasters and injuries, displacement of people. WHO Afro released a report that said that in the year 2021, there was a 56% increase in climate health related public health disasters. And that is, on its own is problematic. We have seen a rise also in the burden of chronic disease in the population, and that's already putting a burden on health systems as more and more people are getting sicker and so forth. We're really seeing a rise in infectious diseases. We've seen dengue, malaria, dengue fever. More people are getting sick, but worse, the response to those ailments are also hampered by excessive heat. There was a paper that was released that showed that vectors such as malaria and dengue are becoming more pathogenic. And therefore they're causing more severe disease in population. And also the ability of the human body to respond to these infectious diseases is also weakening, because as the ozone layer gets depleted, you get more ultraviolet light, more and more people are getting, people are not able to respond properly because of an impaired immune system because of that. So no more people are getting more sick. We have seen infrastructural damage due to wildfires in South Africa. We saw, infrastructural damages due to floods, and then you can still link floods to excessive heat. And that has cost billions and billions of rands to repair. But what underpins the poor response is healthcare, the lack of capacity building. Healthcare professionals are not prepared for excessive heat. With the traditional way of training, we're not prepared to embrace the transdisciplinary approach that comes with climate health, in that, this is not a solution just for healthcare workers. This is a solution that requires an engineer, an architect. When you're thinking about built environment, and others, you need a wider team effort, and not just from the healthcare sector. And healthcare workers do not have enough resources and tools to be able to respond. Also, lack of clear policy directives and guidelines, and this is why the Chance Network is here, to be able to collaborate on making sure that we get clear policy directives and guidelines that we provide to healthcare workers on how to respond. Next slide, please, Chair. And this is some of the impact as more people flood into health systems, and health systems are completely overburdened. You can imagine with excessive heat, with waterborne diseases that are affecting children, and we talked about pregnant women and the risks that we are now showing in terms of pregnancy outcomes to them. And you have few healthcare professionals that are able to respond, and hence the demand is greater than the supply. Next slide. Next slide, Chair. So, we in terms of, and this is some of the discussions that we will have later on, we've proposed a framework for intervention, and I'll just touch on it at a high level because we'll delve into this later on. That what is critically important is interventions at different levels, from the community facility all the way to national and international level, looking at the various components. And this framework applies to healthcare workers as well, because what is key to their response promotion of self-care, the healthcare workers are better positioned to promote patient and community awareness. Right now, climate change is still an abstract phenomenon. It's not like COVID-19. And therefore, there's a need to raise awareness. And who better than a healthcare professional to be able to do that? Health systems need to be prepared for events that are hitting us and making sure that we're able to support through vulnerability assessment, disaster management, etc., to make sure that we prepare for the oncoming onslaught. And then I talked about capacity and research. Roop showed that there's lack of research, especially in the African region, and this is something that we need to build on to be able to generate that evidence so that we can attract more funding for more adaptation and mitigation interventions. And last one I want to touch on is the climate advocacy, climate justice and policy advancement. Climate justice in that, as one of the, during the rant, someone said that the poorest are the ones that are disproportionately affected. So there's a need, especially in Africa, to develop a network that promotes climate justice, making sure that there's equity in our response to the climate crisis. Next slide, Chair. Next slide. And I think that's this is the last slide, in that, climate science has a blind spot when it comes to heat waves in Southern Africa. And right now, right here, this is a time for us to change that scenario, to make sure that we act on behalf of Africa. Thank you very much. Over to you, Chair.
Thank you so much, Gloria, for this wonderful insight. And also, we hope we'll discuss further about health systems preparedness in our discussions. Before that, we will welcome our last speaker, Caroline, to give a presentation, and please introduce yourself.
Thank you, Chair. I'm going to share my screen, but I see I'm not able to. It's disabled.
You should be able to share now. I removed mine. Probably Bettina could.
Yeah, now I'm able to.
Yeah.
Sure. Sorry. Are you able to see my screen?
Actually, we see the presenter view. If you click on display settings on top there in the black bar, and you can switch the display.
Well, thank you. Thank you, Bettina. My name is Caroline Muthoni. I work at the Aga Khan University here in Nairobi, Kenya, as a project officer for the Indirect project. I'm also part of the Chance Network, which is currently hosting this session. It's quite a pleasure to be here. And I'm going to be talking about possible solutions, right? And what are some of the key asks for policymakers? Sorry. You still seeing my screen?
Yes, we are.
Okay,
we're still on the opening slide.
Okay, thank you. Well, most cities in Kenya, Africa, I'm going to stop my video because I'm having bandwidth issues. So just give me a moment. Most cities in Africa are still growing, and this is a good thing because it means we can change the trajectory of our growth and incorporate more climate-friendly developments. And we need to make our cities heat resilient and ensure that we put in mitigation measures. And so who are some of the key decision makers, and what are some of the solutions that we can explore with these policy makers? Some of the people we can talk to include urban planners and city leaders. We can also talk to decision makers in the health sector. We can talk to people in the disaster management sector. Also include people within the national government, research, also academia. For the urban planners and city leaders, Some of the things we can talk to them about include some of the things that are listed here. We can start with simple solutions, like ensuring that our cities have vegetation. And we know that trees and plants, they provide shade, they cool cities, they improve air quality, and can reduce the urban heat island effect. Others might argue that space in urban areas might be limited, but you can easily integrate small infrastructure practices into areas within the cities that have barren areas, that have vacant lots, that have pavements, and even the road reserves. And we can also have cooling spaces. These are places where people can go to when it's too hot. And it can be as simple as putting shades in existing bus stops. And I cannot stress this enough, trees, trees, and more trees. We can also ask our policymakers to ensure that wetlands, existing parks, forest land, and vegetation around rivers are protected by laws and enforce heavy penalties for those who break these laws. Other innovative methods include construction of heat-resistant buildings, which can reduce vulnerability to heat for residents. And we can do this by changing the materials that these buildings are built from. As we know, our urban areas are mostly dominated by dark and hard materials. These are things like concrete, most of which absorb rather than reflect the heat. And studies show that these structural cooling methods are the least expensive in terms for cooling, both financially and environmentally. So they are quite good innovation that our people need to start looking into. Green roofs are also an ideal heat urban reduction strategy. Green roofs provide cooling effects, they improve the air quality, and they also help in absorbing pollutants within the city. The use of light-colored concrete and white roofs has also been found to be effective, and they reflect light and cut down ambient temperatures. These strategies have shown to offer great solutions in reducing the heat within cities, and they can also reduce air conditioning demands. We can also enhance our public transport systems. There's a need within African cities to expand roads with an increasing number of cars, but I think strengthening existing public systems and reducing reliance on private vehicles can lead to numerous other benefits, including reducing emissions and improving our air quality. Roads and people who develop these roads should also consider cyclists and walking lanes more. We can also do slum upgrading. People in informal settlements are considered to be the most vulnerable. Studies have shown that health impacts of heat stress are higher among slum dwellers because of the vulnerable household structures. Among other things, improving the conditions of these informal settlements can also help reducing some of these vulnerabilities. And last but not least, we can look at waste management. Waste in cities is banned, and this causes increased temperatures. And during hot days, the uncollected waste also affects the air quality, and we need better waste management systems that also focus on recycling. For health workers, I think Gloria has covered this in quite an elaborate way, including making sure that there's communication on some of the heat-related effects, ensuring that we have better access to health services, and also supporting the health workers within their facilities. So I'll not delve much on that. We've already heard about it. And for the disaster management teams, we need to ensure they're better prepared to deal with heat-related disasters. And on my last slide, sorry, for other people who are stakeholders, some of these people inform policy. These are people like scientists and researchers who can provide more evidence on the effects of increasing temperatures in our cities. They can conduct vulnerabilities assessments, inform areas of priority actions. We can also use early warning systems that can reduce the consequences of heat waves through timely notifications. Employers can create better work environments to reduce occupational heat-related issues. And policymakers can develop guidelines and heat action plans. I know Nairobi where I come from, has a climate action plan for the city for 2020 to 2050. So this is a great step forward. And these actions require funds. Leaders within these cities need to make sure they budget for climate action in their annual budgets. And lastly, we need to incorporate climate education. This is important so that the next generation of leaders can be cognizant of the importance of creating greener cities. Thank you. That's the end of my presentation. I'll hand it over to Vincent.
Thank you so much, Caroline.
Yeah.
Panelists for the wonderful presentations. And so far we have heard from your presentation on what cities, as well as the impact the heat has on our healthcare systems, and also the potential. So we want to jump into the panel discussions in the next 10 minutes. And we want you to address some of these following questions, and I want Bettina to run through those. And before we go into our breakout groups. So Bettina, with the questions that we have for them.
Right, thank you. And Roop, maybe I can also ask you to turn on your camera so we can also see you. Gloria, you are excused. I know you're not feeling well. Nevertheless, I hope you can still contribute. Good. Now we heard from you guys some problems, some solutions, some ideas. And I have a first question to you. So you say, I think Roop, you said, do you have a cool place to go to? Now, what if you don't? And what are the limits to adaptation to heat in African cities? Do we talk about this at all? Is this something that is well explored or understood? Is this something we need to explore? Because I think we all know that in many areas in cities, air-conditioned spaces are scarce and they're very hard to operate. And like in South Africa or many other African countries, you have load shedding or power cuts, air-conditioned spaces are not to come by. So how to deal with this? And is this something that we understand well?
Maybe I can start. So that's a lovely question, and one that is coming up more and more often when we talk about heat, because often the first intervention that people will mention is cooling centers, but it's not always practical to have a cooling center with air conditioning in many places. And I will tell you, the cooling centers that were operated by the Vietnam Red Cross didn't have air conditioning. So they had a sprinkler system, they had fans, and they had evaporative coolers, because those were the things that were accessible to them and that worked in that region. And so when we say, do you have a cool place to go? I think it can't always be air conditioning. It might be that maybe you've experienced this, it's a really hot day and you walk past an area with lots of vegetation. It tends to be quite a bit cooler. So is there a public park or a public, a forest or some other region within your city that you can go to for refuge? That's one option. I also think another thing that is important for us to think about is, how do we start cool? I think one of the things that lots of people say that you should do is, instead of allowing yourself to get hot and get to a level of heat exhaustion or heat stress, is how do you prevent that in the first place? So ensuring that you can retrofit, maybe even in your own home, adding shading, ensuring that your windows are shut. So there's lots of research being done at the moment on how do you retrofit slums so that they can reduce the amount of exposure to extreme heat. I don't think we're quite at that level where we know exactly how to do it, but I think that's one area that we should do quite a bit more research in, but also passive cooling and building infrastructure that allows it to stay cool when it does get very hot.
Thank you, Roop. And it reminds me a little bit of the all caps rant that we did earlier, where someone says indigenous solutions. So maybe this is also something to explore, right? How do people traditionally stay cool under the conditions that you find in particular cities, and how can we maybe emulate some of those approaches? Very nice. I was assuming the cooling centers were air conditioned, so also thank you for pointing that out, Roop. Great. Let me turn to Gloria. And Gloria, if you can still speak, that would be lovely. Because I wanted to ask you. So you talked about how it's really tough for the health workers, and I wanted to know. So how are people affected that are seeking medical treatment in clinics under extreme hot conditions? Could you unpack a little bit in how that can affect people, and what kind of capacities do we need to mitigate some of these challenges?
Thank you, Bettina. You know, access to healthcare is dependent on a resilient, strong healthcare system, and a strong, resilient healthcare system is dependent on healthcare workers. As more healthcare workers are affected, you know, by excessive heat, your supply, so to speak, diminishes. And as your supply diminishes, then access to care for the vulnerable becomes a problem, because you show up at the clinic, there's only 2 nurses who are available. You know, everyone else is taken off sick, or they're burnt out, you know. So that, you know, already just getting that, you know, care in the first place becomes, you know, compromised. And secondly, you know, as healthcare workers are hot and bothered, they don't, you know, the poor stuff attitude. And this is something that we've been grappling with for years, you know, and so how do we treat people better? But can you imagine when you're sitting in a labor ward and, you know, the temperature is sitting at 30 degrees and you know, you just, you know, don't have that capacity to be empathetic, you know, to provide that quality care. So, and it's the quality of care that gets affected. But more importantly, the access to healthcare has become problematic for many more people now, who now need to access those healthcare systems. So now we need to go back and think about how do we build that capacity? How do we rebuild that capacity as far as healthcare workers? And capacity is twofold. It's capacity in numbers, making sure that there are enough warm bodies to be able to manage patients. But capacity is also the skill, you know, because if someone comes in with heat stroke, our healthcare workers don't know how to manage that. So it's both, and it's in terms of numbers. I think, you know, it's time we started looking at decentralizing care and bringing in other cadres, new cadres of staff to come and, you know, support our buckling health system. So bringing in environmental healthcare workers, community healthcare workers, you know, and triaging patients so that your core healthcare professionals are able to cope with the workload that they're facing. Thank you.
Great, thank you, Gloria. And there's clearly a lot that we can learn and implement, and I think make stronger linkages with the climate discourse for sure from these experiences. Thank you, Gloria. Caroline, I want to put you on the spot a little bit. Now, you talked about the importance of planning in African cities. Now, some of us who work in African cities or live in African cities or both, we know that planning is always a bit of a tricky issue. So now you say, so you don't need to deal with the existing problems, but you also need to expand it to do really good planning for heat waves that might increase in intensity in the future. So how do we navigate this? Because it seems like a big ask, and I hear it's important, but do you have any suggestions of how we could possibly tackle this in Africa?
Thank you for putting me on the spot, Bettina. That's a really good question. And it's a challenge to start bringing in issues of climate in an area where we still have so many other priority issues. And it's always a problem because they tell you we don't feel like climate should be one of the things that we're dealing with. We're still trying to improve our public transport infrastructure. We're still trying to figure out so many other things, and we feel like climate change should be at the bottom of the things that you're dealing with. It's not a priority. And so feel like one of the ways that we can navigate that is, first of all, incorporating some of these solutions to already existing plans, and also learning from other countries that have already experienced this. We already know that Africa is temperatures are already increasing, but we also need evidence. We need to bring in our researchers to provide evidence that can inform some of these policy changes that we're trying to enforce. And I think with evidence, it's likely to be more easily acceptable rather than saying, let us prepare this because it's this and this is going to happen. Yeah. And so, yeah, I feel like number one, incorporating some of evidence from our researchers, and also putting in plans that merge well with already existing plans, and also learning from other cities that have already experienced this and how they dealt with it. We can also pick up on their best practices. Thank you.
Thank you, Caroline. And sorry for putting all three of you on the spot, picking up on things that you've said. I think this is also something we need to do more, right? Is to really think a little bit out of the comfort zone and to say, so what action can we take and what really must happen next? Because I think we realize, and we're quite aware, we see the evidence everywhere. We don't have the luxury of time to really move slowly. We need to move fast. Vincent, do you have any questions for the panelists, or otherwise we'll open the floor very briefly to any of the participants here. If you feel like you'd like to ask the panelists a question or would like to make a brief comment, to groups to really need to do going forward. Vincent, any thoughts from your side?
I think on the interest of time, maybe probably let me give the chance to the audience to also ask the panelists some questions. Yeah, I think from Michelle.
Hi, thank you. I just want to ask the panelists if they found that in the areas where they work, that heat is taken seriously, because, you know, my experience growing up in South Africa is that it's not, you know, just living in the country, not from a policy or a government perspective, is that it's not taken that seriously. It's just like things are hot and, you know, people must just deal with it. What have your experiences been?
I can respond to Michelle. That's a very good question. You know, I'm also in South Africa, and climate change is still an abstract phenomenon. You know, with COVID-19, you could see you get COVID-19, you have symptoms, and then, you know, so people took it very seriously. Whereas with climate change, you know, the impact are not yet visible. I mean, we'll get there, but I mean, they're already, I mean, we're seeing floods already. But it's still, you know, an abstract phenomenon. And already, if you look at healthcare systems, there's so many competing priorities that, you know, it becomes one of the things like, oh no, just put it, you know, aside. But, you know, however, I did an interesting presentation to the health authorities last week on climate change. And as, you know, I was doing the presentation, they were able to connect the dots. And they were saying, you know what? We've been wondering what's happening with our birth outcomes. There's been a problem with the birth outcomes. And therefore, there must be something about climate. You know, there must be something about what you're saying. So I think it is about advocacy. It is about presenting the evidence and helping people to connect the dot, but not just health care workers and health authorities, but also the community. You know, and especially in Africa, where you say, listen, you know, the ozone is depleting. You know, you're getting, you know, see what's happening in your environment. People are already saying, you know, it's getting hotter these days. You know, people say that in layman's terms. You know, I don't know what's happening with the temperature today. It's just so hot. So there is already that momentum, you know, but it's not happening at a fast pace. And I think it's up to us to make sure that we put climate change on the top of the agenda going forward. Thank you.
Thank you. And Vincent, I see there's a question in the chat, and maybe Roop or Caroline, you can respond to this one. Amy is asking, can you share an example of an African city or two that are leading on heat?
Caroline, do you want to start?
Sure. The moment, I think my mind goes directly to South Africa. In Kenya, we do have action, but it's not basic. It's not specifically on heat. It tends to cover all aspects of climate change. And one comment I'd like to make is we will be exploring the South African guideline on heat this Wednesday in our network, which we'll get more details on. So I think there we can get some of the answers. I cannot speak for on behalf of South Africa, but I think that they've made good progress, and we'll be hearing more about this Wednesday. And our chair will give us more details.
Yeah, absolutely. I think in terms of examples, I've heard of a couple of smaller examples. So like Caroline said, there is some work being done in various cities in South Africa. In Freetown in Sierra Leone, there's a chief heat officer that was appointed. In the Sahel, there is a heat warning system that's currently being developed with a couple of different countries within the Sahel. But I don't think that at the moment I can point to a city that has become super advanced in terms of their heat warning system. I think we don't really have an example of that, of where you really see a comprehensive heat action plan that includes seasonal planning and early warning system and all of these things that we think of as good practice. And in some ways, I find that a little bit concerning because, of course, the projections are that we're going to see lots of impacts in these cities very soon. But I think that's also part of our call to action in that we want to see more of this. I also want to address the question that was asked earlier and maybe share one example, a parallel example from another continent. So I know in recent years, we've heard a lot about heat waves in India, and we've heard a lot about heat action plans. It's touted as an example of a place that's really done well. But if you go back 5 years, maybe 5 or 6 years, no one talked about heat in India. It was thought of as, you know, we're used to the heat. Heat is in our blood. It's something that we've always dealt with, and it's not unusual. And it wasn't until you really started to see the numbers associated with heat waves. So particularly when we started to count, okay, we see 500 excess deaths during this particular heat wave event, that policymakers and people really started to awaken to the impacts. And it's not like heat waves didn't occur previously. They did. We just didn't necessarily have the numbers to back up the impacts. And so I think in part, one of the really important things across Africa is also to make those connections so that people really understand, look, we're starting to see excess mortality, but also morbidity and all of these negative health outcomes. And so that's how I saw a much more focused action on heat in India. And I hope that we can see more of that across cities in Africa once we make it clear that the impacts are happening and they're happening now.
Right, thank you. I think a very strong case to make this link more visible, give it more attention, really think creatively around what we can do, how we can think about solutions before we are, or maybe we're already reaching some limits to adaptation, but before we're reaching them at a vast scale, I think is maybe how we can put it also. And this is the moment to open the floor to all of you. And I know for some of you, it was a long day, but we invite you, and imagine how it used to be when we would meet in person. We invite you to go into, you'll be allocated one of 3 rooms to talk about what are the key, thank you, Vincent, what are the key messages that you think we should be giving to, and depending on your groups, to policymakers, to researchers, and to local stakeholders. What do you think are maybe 3 key messages we should be giving them? Let's not be too over ambitious. Let's give them 3 messages. What do you think we should tell national policymakers, researchers, and local stakeholders when it comes to heat in African cities? And we'll have about 12 minutes for you to discuss. So be short and sharp. See if you can say hello quickly to whoever you find in the group. And then we'll come back here for after 12 minutes, and we'll hear your 3 messages to these key groups that we think they need to hear us. Sound okay? I hope you'll all be able to unmute your microphone and participate, because we really would like to hear from you. And can I ask the organizers to send us into our groups, please, and to help us return after 12 minutes? Thank you. You see a window that says join breakout room. Please join the room that is there. And thank you, Kumbuzile, for your comment. We'll come back to it when we return. Enjoy the breakout room. If the window has disappeared, you can click at the bar at the bottom that says breakout room and join the breakout room. Hi, welcome back. I think everyone is back by now. Vincent, shall I quickly ask for the 3 key messages from the 3 groups? Let me see, who'd like to go first? Maybe we start with the national policy makers, and I can quickly kick off from our group, group 1. We had 3 messages really that we wanted to put forward. The one is, we thought it was really important that there is a national guideline on heat in South Africa, but if there is a national guideline on heat, that one really ensures that this is implemented on the local municipal level and that it has adequate budget so it can really be implemented effectively. The first message. The second one was, we need to have a better understanding in how the climate and extreme temperatures are challenging people, also in terms of their livelihoods options, and also to really help them take better decisions going forward. So for example, if you want to start chicken farming, can you build houses in a way that already anticipates extreme heat? And for this, you need to have good information to be able to do this. And third message was to say, can we understand vulnerability across different groups better to guide decisions? Can we have something like a national survey to really understand what is going on and where particular pressure points are when it comes to extreme heat in cities? And maybe we can go to the next group, and that is, what are key messages to researchers? And can we ask the researcher group to give us their 3 messages? That was Lesego, Michelle, Rim, Stephanie, and Yoliswa.
Okay, so I took some notes for us, and we concentrated, our 3 areas that we concentrated were really asking researchers to collect data and get stories from communities on the ground, especially in informal areas, so that the research is really gathers lived experiences from people that are really experiencing the impact of heat severely. Then it was also around feeding the information back to these highly impacted communities in ways which are appropriate and engaging. For instance, there were some ideas for plays or story workshops, things like that. And then the third one was, oh yes, funding and research also to go to areas that are not as accessible. So maybe where it's not as easy for research to be done, but to make sure that research is also being done in those areas. I'd say those were our top 3. And I'd ask our other breakout group members to please add if I've missed anything out.
Thank you, Michelle. Any additions to group 1 or 2, actually, I must say, in all fairness? Good point. Nope. All right, and then it's time for group 3. local stakeholders. So what are our messages to local stakeholders? And I can see, Caroline, you're unmuting your microphone. So I assume you're speaking on behalf of Amy, Emma, Gloria, Lucia, Roop, and yourself?
Yes, I did take some notes, unless any other group member would like to present. So I'll go ahead. We started with some of the local researchers that are already in the field collecting data, and someone mentioned Slum Dwellers International, who already do data collection, and we said that we could embed research on health impacts of heat for people in these informal settlements, which is a good idea, because then you don't use up a lot of resources. Rather, you sort of engage research that is already ongoing. We also had a message for civil societies to lobby policymakers and guide them. We also had messages for the media to do a lot of media exposure, and someone gave an example of COVID-19, how it received a lot of media exposure, and so that would also be great for some of these topics. And for other local stakeholders, for example, village elders and chiefs, they could request for education on matters on climate so that they become sort of the middlemen between the communities and policymakers. And we also had a discussion on community health workers, how they could receive basic first aid on heat stress for them to, since they're the first line of defense for community members. So it's important to also have them involved in this conversation. And we could link up solutions to impacts. I think this one tends to be quite a strong argument, and giving solutions how to address some of these heat challenges. And then our last point was school children involvement and ensuring that they learn about heat and climate change. Thank you.
Fantastic, thank you. I think this there's rich picking here, lots of things that are key messages, and actually in it, lots of action that we can take on local level, on as a researcher and as a national policymaker. And with this, I'd like to say thank you so much, and I'll hand over to Vincent to do the closing of the session.
Thank you so much. Thank you so the participation, and also thank you so much the panelists. That was a wonderful session. We've actually learned quite a lot. There are quite a lot of key messages that came out, which stood out, and I believe that as we'll have a stake in this issue of heat in cities. If you're a researcher, if you're a policymaker, if you're an NGO, that I've got out with. In closing, I'll say from the Chance Network, we want to thank you so much. Like I said from the beginning, this is a network that invites everyone who is interested in climate and heat nexus. And we have a lot of activities that are ongoing. We do have our bi-monthly meetings. The next one is coming this Wednesday, where we'll be unpacking the heat health guide. Deputy Director from the National Health Department, who will be unpacking their, so you could join us and also learn from South Africa. We also have our annual meeting next year, so you as well to attend. And also, if you want to join our network, welcome. Click on it and maybe take your phone, and you'll be directly linked to the link where you can just join, or you can take my email there, vpagiwa@ub.ac.bw. That's my email address. If you send me an email, I will make sure that you have joined. Thank you. And I hope that I will receive most of the emails after this meeting, and I'll see new members joining the Chance Network. Thank you so much, the organizers. This was a wonderful session. The team, before we close the session.
I think I hand over to Lisa.
Thank you, everybody. And
Thank you so
thank you
much.
for your participation right until the final bell goes. So really thank you very much to the team organizing this fascinating session, and we really look forward to sharing messages around heat health in African cities widely. And we have a graphic harvester is also going to have a graphic of this session, so we'll be sharing that as well. Look out for all of that on our Twitter feed, the CDKN Twitter feed. We have been live tweeting this session as well. So there's lots of messaging that has been happening outside in the world. And please join us tomorrow for a continuation of the Africa Resilience Hub. And we'll be kicking off with financing climate resilience in Egypt.